Improving food safety through a One Health approach. Zoonotic diseases that are transmissible to humans, such as avian influenza, rabies, Rift Valley fever, and brucellosis, pose global public health threats that must be prevented and controlled. Animal pathogens that are not transmissible to humans but have a significant impact on the production of animal protein should also not be neglected, especially in developing countries. Indeed, they can result in production losses and a decrease in the available food supply, resulting in serious public health problems associated with food scarcity and protein deficiency. These risks are increasing as a result of globalization of trade, global warming, and changes in human behavior, which all create multiple opportunities for pathogens to colonize new territories and evolve into novel forms. Did you know that 60% of pathogens that cause human diseases come from domestic animals or wildlife? 75% of emerging human pathogens are of animal origin. 80% of pathogens that are of concern for bioterrorism originate in animals. More than 20% of animal production losses in the world are linked to animal diseases. Understanding the connections between biodiversity, ecosystems, and infectious diseases is crucial. Animal diseases pose a direct threat to the incomes of rural communities that depend on livestock production. From the data of FAO and OIE in 2015, more than 75% of the billion people in the world who live on less than $2 per day depend on subsistence farming and raising livestock to survive. When talking about One Health, the One Health concept encapsulated a concept that had been widely accepted for over a century: that human and animal health are inextricably linked to the health of the ecosystems in which they exist. We envisioned and implemented it as a collaborative global effort to better understand risks to human and animal health, as well as to the health of the ecosystem as a whole. Past decades have shown us that preventing diseases at their animal source is still the most effective and economic way of protecting people. New models are needed to ensure early detection, prevention and control at the human-animal interface to reduce the persistent global threat of emerging animal diseases. Given the complexity of these diseases and their emergence and spread in a world that is becoming increasingly globalized, it is essential to find effective strategies to control them at their source to reduce their potentially devastating impact on health. This can be done by building upon the successes of the past, integrating new control methods, and by entering into new partnerships to reduce future threats. The OIE plays a critical role in preventing and controlling global animal health risks, as a result of its standard-setting activities for animal health and welfare, and because its mandate focuses on global animal health transparency. Within this framework, cross-sectoral collaboration at the national, regional, and global levels is critical to the success of its efforts. The OIE strongly supports initiatives that seek to broaden the scientific basis of positive multi-sectoral collaboration, and to identify ways to put the One Health concept into practice on a political and practical level through its actions. FAO, OIE, WHO, a worldwide cross-sectoral strategy for One Health. Coordination of the numerous stakeholders in human, animal, and environmental health is critical for meeting tomorrow's health challenges. Three major international organizations, the WHO, the OIE, and the FAO, are collaborating to prevent and control health risks at the human-animal ecosystem interface in this context. They are developing global strategies and tools to ensure a consistent, harmonized approach throughout the world, and to improve national and international coordination of human, veterinary, and environmental health policies. For many years, these three organizations have collaborated to prevent, detect, control, and eliminate health threats to humans that are derived, directly or indirectly, from animals. A formal alliance between the three organizations has facilitated the implementation of the One Health vision. In this context, the FAO, OIE, and WHO recognize their respective roles in combating diseases with severe health and economic consequences, particularly zoonoses. The basis of the FAO, OIE, WHO tripartite alliance. In 2010, The three organizations released a tripartite concept note, outlining their collaboration and shared goals for preventing and controlling health risks at the human-animal ecosystem interface. They can achieve synergy in their expertise and communications activities on issues of mutual interest by collaborating in this way, mobilizing their public and private partners, member country governments, and public opinion. They meet on a regular basis, and their primary activities focus on early detection of the emergence of animal and human diseases, allowing for a swift and targeted response to control disease outbreaks and prevent their global spread. These actions include strengthening their surveillance and rapid response capacities, based on epidemiological data collected by their respective health surveillance and early warning systems, ensuring consistency across the three organizations' standard-setting activities, the OIE's intergovernmental standards, the WHO's International Health Regulations, IHR, and the International Food Standards of the Codex Alimentarius. Evaluation of and taking measures to manage disease risks. Building capacity for the health authorities of their member countries. The Tripartite Alliance has accomplished the development of joint strategies to prevent health risks at the human-animal ecosystems interface, such as establishment of OIE/FAO Global Network of Expertise on Animal Influenza in 2005. This network of international experts aims to improve influenza surveillance in humans, particularly in areas involving the animal-human interface. Since 2009, it has expanded its scope of action to include all animal influenzas and has maintained a steady increase in activity. In particular, OFFLU collaborates with the World Health Organization to aid in the early development of human vaccines. Fight against antimicrobial resistance. Antibiotics are essential for human health, and animal health and welfare. Antibiotic overuse and abuse can result in the emergence of bacteria that are resistant to antibiotics, referred to as antibiotic resistance. This phenomenon impairs the effectiveness and availability of antimicrobials, jeopardizing the global control of infectious diseases. At the same time, globalization aids the spread of pathogens, including resistant bacteria, across the planet. The joint actions of the FAO, OIE, WHO are aimed at ensuring that antimicrobials maintain their effectiveness, promoting their responsible and prudent use, ensuring that everyone has access to high-quality medicines. Fight against rabies. Rabies continues to claim tens of thousands of lives each year. However, we possess all of the necessary tools for preventing and eliminating this disease. Since 2011, the Tripartite Alliance has worked collaboratively to develop a global strategy for eradicating this disease. Its first priority is good governance of the distribution of resources, both public and private, local, national, and international, to carry out preventative actions in animals, particularly vaccination of dogs. On the 31st of May 2018, the Food and Agriculture Organization of the United Nations, FAO, the World Health Organization, WHO, and the World Organization for Animal Health, OIE, signed a Memorandum of Understanding, or MOU, agreeing to intensify collaborative efforts to address health threats associated with interactions between humans, animals, and the environment. Combining knowledge, insights, and technical capabilities in human and animal health, as well as food and agriculture, can result in significant synergies, resulting in more robust, effective, and cost-effective solutions to the world's complex health problems.